If a surgeon tells you that they don't think that you should get a surgery, I would take that as a blessing personally, even though you're in excruciating pain, because surgery is not guaranteed. You get an MRI on us, we're 30s, 40s, you're gonna find stuff, and it may mean nothing. If you start having incontinence episodes where you're urinating on yourself or defecating on yourself, or you can't feel your groin, or all of a sudden you're having neurological changes where you're falling, or your leg, you have to drag it, you need to get seen sooner than later. That's an emergency.
People will invest like thousands of dollars on some cars or something, but they will not spend time on their mattresses. What role does mattress play in anyone's life?
Honestly, my opinion is that it probably doesn't matter. It's all whatever keeps you most comfortable. A lot of it falls down to marketing. I feel bad for the patients that go and spend $500 on a pillow. I'm talking about opioids.
Is it addictive as well?
100%. You take one medication, you take it consistently for 3-4 months. At some point, your body's like, all right, my receptors have seen that, I need more. And that's just a road to nowhere. You can't test drive a surgery like you can test drive a car. You just got to go for it and then see what happens.
Today's conversation is about something almost everyone listening has either lived through or watched someone they love go through: chronic pain. My guest is Dr. Vats Ambai, a pain management specialist and anesthesiologist at the Nexus Pain Center right here in Georgia. He trained at Emory, Mercer, and did his fellowship across Weill Cornell, the Hospital for Special Surgery, and Memorial Sloan Kettering in New York. What makes Dr. Ambai's approach interesting is what he specializes in avoiding: long-term opioids and open surgery in favor of precise, minimal, and invasive procedures. We are going to get into how pain medicine is changing and what it's actually headed in 2026. Dr. Vats, welcome to the Halak Show.
Yes, thank you.
Yeah, we're looking forward to this conversation today. Previously, we have had a chiropractor.
Okay.
But what profession you bring in is completely different, and it blew my mind. So when I was introduced to your profile, I was like, this is something that's going to be so interesting, especially in the day and age that we live in. Pains are, either we wait too long, or sometimes there's something there, but we don't know what's going on, how to fix it. So for some days, it might look good, then it might resurface again.
Right.
So really like understanding about pain. And today's episode is going to be not just for like any particular age group, because you have seen like in sports injuries or, people go to gyms, they lift weight, they feel good, but then lots of things happening around it. This whole concept of no pain, no gain, all those things. So I'm really excited, and I'm going to walk away along with my audience with something new that we will try to get from you.
Absolutely.
Yeah. Let's first start. I'm really interested in this, right? So you were a medical assistant, you did your fluoroscopy tech med school, and then why start like there versus what you are right now?
Yeah. So that was kind of a chance occurrence. I was looking for a job before I applied to medical school. And I had a friend who was just working in the field, and I was looking for jobs. Nobody hired me because I had finished my master's, and they were just like, this person's not going to stay. Right. So I took whatever job interview I could get. I thought I was going actually to a chiropractor's office to take this interview. Wow. She said they deal with back pain. And so I was like, whatever, I need the money. Right. So I went, and I was pleasantly surprised that there was physicians operating, doing cases, and also taking care of patients in a clinical setting. And that's when I started to realize that this is actual medical practice. I got the job and became a medical assistant there. And so it was a clinic out here in Metro Atlanta, a private practice group. And so they take care of all kinds of pain. That's when it started. So I started realizing that, people, just like you mentioned, of all walks of life are coming in with pain of different sorts, right, and looking for treatment, looking for options. And so at that point, I hadn't decided where I was going to go after that. I was applying to medical school, right, but I had a good idea that I wanted to do something that bridged being in the clinic and working with my hands. And so that's what prompted me to go into this field.
Different ethnicity and different people from like different walks of life, different color, right?
Yeah.
You feel like there's any particular like pattern here when certain race folks have some pain? Do you feel like there is some kind of a pattern we misread, or we feel like there is something to fix there?
Yeah. I don't think
pain.
Yeah. I don't think any one particular race or ethnicity experiences pain more. Okay. I think that it's very interesting, the concept of treating pain. is something I've talked to with my colleagues before, because when you think about it, you go to these other countries that are not developed and they don't really have this field. This doesn't exist. It's actually really kind of a privilege to be able to treat pain. It's almost a luxury as well as a patient to go seek out pain care. Because most third world countries, they're not going to care.
Right.
Like that's not a thing. So that aspect is different. But in terms of different races experiencing pain, I think everyone experiences pain very similarly.
There's no genetics here that can dictate like this particular race might have certain kind of pain versus like, for example, tech professional. I'm a tech professional. I am always this. So I'm always bulged forward and I try to stay straight as much as possible whenever I can. I try to move.
Right.
But then over the years, if you just keep on doing this, you start building that pattern that way.
Exactly.
And then when I'll come to you, I'll mostly be like, oh, neck pain, back pain, lower back pain.
Yeah.
So I was trying to
those things with profession, of course. There's actually a term for that, a popular term called tech neck.
Tech neck, yes. Okay.
Yeah, you'll hear that. And that's when exactly what you're talking about, where you're kind of always flexing your neck, looking at your phone, looking at your computer. And so there's all these ergonomic things that you can do to try and minimize those issues surfacing as you progress through your career. But with professions, of course. And so, of course, you're in tech, you've experienced that. Right. I have a lot of patients that work with their hands. They're working in power plants or on the factory line and things like that.
Right.
So they have different kinds of pains, like knee pains or back pain from laying down and working on equipment. So yeah, of course, profession does dictate a lot of what you experience, especially for our younger, like 20 to 40, where you don't necessarily see a lot of chronic pain injury necessarily for wear and tear from age.
Right.
Then yeah, you have those kind of things.
Okay, perfect. So now that we are warmed up, I was nervous because every time I bring a professional in, I'm never sure if I am going to ask the right technical question or not. So I had to like talk a few things. So now let's talk and let's go back a little bit, okay?
Sure.
So when I was growing up, I had dreams. My dreams were, become an astronaut, become a doctor, maybe become so accountant was never in my dream, but you can be an accountant, you can make money out of it. Pain specialist. Right. Pain management specialist was definitely not on my list. I did not even know that something like this. Like you already have said that third world countries don't even have this concept. They have like maybe acupuncture or something.
Yeah.
How did you get into this pain management specifically? And how is it different from like all these different acupunctures and all that?
Of course, yeah. All of them have interplay. Everything has its place. In my mind, everything can help a patient to some degree. And so it's all about using what we call a multimodal approach to managing someone's pain. So a little bit of therapy, a little bit of if they need treatment for things like anxiety, depression, making sure that that's under control. And then, of course, diet, exercise, medications are one aspect, and then things that I do or surgery. So there's a whole array of things. And so when I think about how I got here, I did not know I wanted to go in medicine. I actually thought I was going to do something along the lines of like anthropology. And I quickly learned that's not going to ever make any money.
Right.
I'm never going to pay back my college tuition for that. And so as I started to progress, I took a class called medical anthropology. And that's really when things started clicking for me. Okay. I really loved the concept of listening to people and understanding their stories, kind of like what you do with your podcast, actually. Right. And so getting these narratives of people, and there's something called an illness narrative. So people describe to you what they've been experiencing and how they got there and what they are concerned about and all those things that they come to you in the clinic when you close that door and they confide in you. Right. And so that really fascinated me. And that's what started getting me to thinking that, okay, I do actually want to pursue maybe a career in medicine. That was halfway through college, more than halfway. And so it was a turning point for me. I had to decide how to get to where I wanted to. So took more courses, and then I had that gap where I was working. That's when I found out about all this. I just happenstance found this field.
So you kind of found your way into this, you narrowed it down further and further, and then you gradually got to that level where you thought this is something that it excites you, it's something that you want to like probably help people cope up with it, and that's why you went towards it.
Yeah, and more I thought about it, when you look at pain in general, if you think about the United States alone, we have this baby boomer population, right? Right. This huge population of people who are aging and they need care. And so I figured, okay, I'm going to be practicing in those prime years when all these people are aging. I'm always going to have a steady stream of patients. I'll never run out of people to see. Then you also think about pain in general. It's probably the number one reason people go to see a doctor. Right. So I know that, all right, I know that I'll always have that kind of work to be done. And then the more important thing that really propelled me to go into this field is that it's constantly evolving. I got exposed to this in about 2015, prior to medical school. And even in that time alone, so much technology has hit this field and it's continuing to grow. So that really fascinated me because I thought, all right, if I'm going to do something for 30 years, I want to continually have something new that I'm learning and developing and offering patients, not just old things and just this is all I can do. Sorry, bye.
Right.
You know, so that was exciting for me too.
Wonderful. So let's dive a little bit on the sports side. I love playing sports, and I've always been engaged towards sports. More than watching sports, I love playing sports.
Yeah.
But then I got injured one point in life years ago on my left knee, and then I kind of got the X-rays and everything done. I went through the process and everything. Psychologically, my mind always goes there whenever I'm doing something, when I'm playing a sport again. I try to now build myself as I'm growing older. I need to really protect my knee more and more, and my overall body I need to protect more. So I'm getting more on the fitness side of it
right
now, more than ever before. But psychologically, that's still there. I feel it's nothing there, but my mind goes on it.
Oh yeah.
And instead sometimes I'll be heavy on my right foot to compensate for it.
Yeah.
Can you talk to me about this happens to a lot of people once they have been in an accident for years? It'll kind of haunt them. When they drive.
Yeah.
It's like a must. It's like in your mind. It's
PTSD
there.
Almost.
Yeah. In a way. And sometimes I can be extreme. It's not there, but I can be the person who needs to be taken care of. But why does that happen? And what can we do? Can we do anything about it, or how can we learn to understand what that was and move forward?
Yeah, I mean, I think the most important thing is when an injury occurs is to make sure that you address it, whether that is aggressive physical therapy or surgery or something like just bracing the area or having an injection, whatever it may be, get the problem fixed or at least, do the right things to prevent it from occurring again. And then, it is psychological, what you were explaining. It's normal. Most people are going to have that fear that I'm going to re-injure it because they remember that pain. They remember what they felt in those moments, those weeks, that month, that they really couldn't do what they loved to do. And it changed their feeling about how they were going to, progress in the future. Am I going to be able to play tennis again? Right. And so it is a thing that happens to a lot of people, and it's hard. I see it all the time in the clinic. People are like, man, I just really wish I could go golf again. I really want to golf again. And
right.
Some of it is level setting and you have to modify things. And that's how I approach it with patients. I'm like, look, you're not going to go hit 18 holes and hit 300 yards. That's probably not going to happen again. We just have to be real. That's not safe for you.
Right.
But I still want you to go out there. I still want you to, hit with your friends and maybe do a round of 9 and then take it easy. Don't go all the way on your swing. Just, nice swing, take it easy. Don't aim for the fences, those kind of things.
Right.
So it is hard. I can't, promise you that you're going to be 100%. I'm not that kind of doctor. I try to keep it in perspective, but if you do the right things, there's a good chance that you'll be able to recover and get to do the things that you want. But you might have to modify things.
Right. One thing I'm fixing right now is really losing weight.
Oh yeah.
Because then it relieves the pressure. So that's what I'm aggressively working on that right now. And that's been my total mindset is I'm zoned in, so to say.
Yeah.
And starting with a 90-day hard.
Good.
Probably I'm in my 6th day.
Nice.
I'm trying to and in a way I think vlog is kind of helping me now that I put it out there. Now I should show up and
you're held accountable.
And what I have done is I've started every weekend go for nature walks, just go on trails.
Yeah.
That's the most liberating thing with me. And I take my kids with me. My wife goes with me, and we 4 of us just no phones, nothing, just walk, light jog.
Yeah.
And I did not know that I could light jog. I mean, even if it takes me 14, 15 minutes to do a mile, but just steady keep on doing that for 3 miles. I don't like skipping.
Yeah.
So I just do small steps instead of skipping. I just go forward.
Right.
That's really helping me now. And now I'm feeling better and better. But it's just 5th day so far, so it's going to be a long journey.
Yeah.
But I'm prepared for it. I am ready for it, and
Good.
I want to give it my all. So let's see where it ends. So let's talk about evolution of pain management. I want to talk about the Indian in India versus here, right?
Yeah.
I've observed 2 things. First thing is, and you tell me if it's right or wrong, India relies heavily on medication. When it has a pain, you just take this thing and you'll be fine. And then here we go for therapy.
Yeah.
And they advise that go do a therapy.
Right.
That's one thing. But then on the other side, what here we do is sometimes if somebody's aching and having pain, it just takes them so much longer to get to that doctor or that level, and in that process it might scale the injury big time. What's the difference that you see from an expert opinion? What's happening right or wrong here?
I think that it is interesting that the way different countries approach pain. If you look back in the history of pain management in our country, in the U.S., there was a heavy opioid epidemic. That was a big problem. And things have shifted a lot in the last 15 years, where people are less reliant on just medication alone. And so the only real thing that is going to prevent injury further or prevent arthritis from progressing is, taking care of your body, whatever that means. Like you mentioned, losing weight, that's probably one of the biggest things. Core exercises, if it's your back pain that's really bothering you, strengthening those muscles that really provide scaffolding for the actual spine. Right. Those are the things. And that's why people really are harping on, physical therapy, because I could throw all the medications at you. We could do 10 surgeries. I could do 100 injections. I could do all these fancy procedures that I can offer. But if you're not doing the things that you need to really try and keep your body, right, take care of the temple that you have,
protect it, right?
It's these things are all temporary,
right?
And when you think about India, I always separate. I was born here, so I have a different perspective. I always look at India kind of in different aspects. Like, of course, there's the part of India that we know through our families that people are pretty, middle class, well off. So we have access to care. We can access care quickly. Here, you have to obviously go through all the channels. You got to have insurance. You got to wait for a referral, all that stuff. In India, you're like, I pick up the phone. I know a guy who's a doctor. He calls another doctor. I'm in the office the next day.
Right.
So that's a difference, I think, in access of care.
Right.
And also, people are more willing to, if they have the connections, to help you. Right. Here, everyone goes by the book. And I think that things are kind of leveling across the globe. If you look at like Korea, India, there is pain management that's developing now, and it's matching what we're offering here in the U.S. with managing, like what I mentioned, the multimodal aspect, where we do medication management, we do an injection here or there to really turn down the volume of pain as much as we can, and then see how the patient progresses with physical therapy. Right. One caveat I'll add, though, is that when I always approach a patient, I always tell them, look, my job is to try and get you better. I'm not going to get you 100%, but I'll have a window of 3 months, 6 months where I make you feel better. In that window, that's your time. That's your time to work on your weight loss, stop smoking, go to the gym, or even better, work with a physical therapist so they can watch you do exercises in a safe way.
All right.
Then learn them. And then it's important for you to do them on your own, because you going to physical therapy for the next 2 months isn't going to change the next 20 years. You doing those exercises for the next 20 years is crucial.
Consistently is the key here, right?
Exactly.
And what about the medicine part of it? Like your pain medicine, just take the pain meds and you'll be okay. I've seen it. I've more than seen it. I think I feel like that's a trend in India.
Yeah, it's very
and even for the privileged ones, like you said, right? Get a heavy dose of prescribed medication that you can just take instead of talking about it.
Right. Yeah.
So how do you see that? Have you seen that as well?
Oh, yeah.
As a trend?
Yeah. So, in parts of modern training, like in the last 5 years, there are lots of programs that don't even expose trainees to managing pain medications. And when I talk about true pain medications, I'm not talking about your anti-inflammatories or your nerve pain medications. I'm talking about opioids.
Yeah.
Like that's what a greater vast majority of people, when they're in pain, when they look to seek pain care and they want medications to help manage their pain, they're asking about opioids most of the time. And there's a risk with that.
Is it addictive as well?
100%.
So once you start, you will just want to keep on.
Not necessarily. It's all about giving the right dose, low and slow. That's what the right way to do it, and for the appropriate patient. So obviously, if you've had your surgery, you probably need something right now to get you through it. Do you need to be on something for the next 5 years? Probably not. That's not the right way to approach it. Right. But that's a lot of what was happening back in the day, is that people would be started on pain medications because they have pain. And then doses would escalate, because I don't know if you drink right now with this wellness journey that you're on, but
no, I've cut down. I'm almost out of it.
Like, surely you've had beer before, and when you're younger, you could have 1 or 2 beers, and you're like, all right, I feel it. Then you start to have 2 beers, and you're like, I can't tell anything. Let me have 3 or 4.
The tolerance
Exactly. So the same thing happens with opioid medications, pain medications, is that you take one medication, you take it consistently for 3-4 months. At some point, your body's like, all right, my receptors have seen that. I need more. Right. I need more. And that's just a road to nowhere. And that's what I worry about in these other countries that haven't had that much opioid exposure, gone through the kind of the epidemics that we have with opioids.
Right.
And it's something that I don't know too much about in like India, for example. I know that people do prescribe opioids, but it seems very few and far between that people are getting true pain medications for just general pain. That's probably the right way to do it, actually.
Wonderful.
Yeah.
Yeah. So this just gives us perspective, like
Yeah.
what are two different techniques here, according to your expert opinion, what works better. So like we feel like more of like giving it some time and dedicatedly focusing on it.
Yeah.
With like the solution. If you can don't have access to the physiotherapy, but just try and work on your body for the couple of forever, I would say.
Yeah. Whenever
it's a lifelong journey.
It's not going to work for everyone. Pain is very complex. It's it's going to be your biology,
right,
and then also your psychology, and sometimes even the social aspect. So
correct.
The stressors that are in your life, the work, the family environment, your living situation, all of that will play a factor in how you perceive pain.
Absolutely.
So yeah, it's not like physical therapy is just going to cure it all.
Right. No, absolutely. No. And so I want to talk about a little bit about in sports, right? So we see all the athletes, and you be it cricket or basketball or even soccer. This is one of the biggest ones because you are running, sprinting like nonstop.
Yeah.
Now you can see like for example, I'm going to take an example of Indian cricket team. Okay.
Yeah.
They travel with so much of extra, like there's a physio, there's this, that,
orthopedic
like
surgeon,
the
all
whole
that,
fancy equipments. And they are standing on the field for like hours. So they do need to go and get a massage because their muscles are so cramped up. They're playing in heat. They're in any sport when it's outdoors, they're playing in heat. There's so much exertion, right? Do you feel like pain management now can increase the longevity of an athlete?
Not necessarily. I think that things like maybe regenerative medicine, which is a whole different subset of pain management. I don't know if you've looked into that, but it could be an interesting episode actually for you in the future. But regenerative medicine is a whole field where you're trying to basically use your body's own processes to heal itself. And so that's something that you'll see a lot with major athletes exploring things like platelet-rich plasma injection, stem cell therapy, all of these things.
That's straight up like Captain America.
Yeah, it's
very feels.
Yeah. I don't know too much about that. But
because of the serum, right? He takes a serum that helps him regenerate
if it's
his wounds by itself.
You'll see those peptides being advertised online and things like that. All of that falls in that wellness sphere that a lot of athletes will be using to give themselves that competitive edge, keep themselves as fit as possible so that they can continue to compete at the top of their game. So,
but does it have like any long-term repercussions?
Yeah.
When you do that?
I always tell patients nothing is free. There's always side effects. Like even if you look up the side effects of water, it will say it could kill you. So obviously we drink water every day, but everything, with perspective and getting the right professional advice, because for every 100 things you see out there, only probably like 10 or 20 of them will actually be something that's safe and maybe effective for you. And I say maybe because it's not always effective. A lot of these things are, you have to be the right person, have the right kind of setup for everything in order for it to be even remotely beneficial for you. And so that's a big thing to take into consideration.
So regenerative therapy is what you are saying that, it'll be a very exciting topic. And do you deal with this kind of
I do a little bit. I do a little bit of regenerative medicine. I have not explored it too much just because
Are you planning to?
Yeah, I'd love to. It's all cash paid. That's the hard part, is that you have to have the right kind of patient population.
What does that mean?
Insurance will not cover any of this.
Okay. Okay. Got it.
To them, it's all completely experimental, regardless of how many studies have been out there. And so I always tell patients, like, if this is something you're exploring, you should, know that it may not work. Two, I only choose it for the right people, or I only recommend it to the right people, because sometimes I'll have patients in their 80s that are like, hey, what about PRP, platelet-rich plasma, for me? And I'm like, probably not the right thing for you. You want the perfect storm, a younger person who's very fit and doesn't have any comorbidities, and it has to be almost like perfectly lined up. And if they still want it, I tell them, like, look, I'm only going to offer this to you if you're like a millionaire and you have plenty of money to blow and you have no concerns. Because overall, that kind of therapy, out of the ones that are out there for regenerative medicine, is pretty safe. It's your own blood product, harvested, spun down, and injected back into certain parts of your body. So the risk is pretty low, outside of course, infection or bleeding based on where you inject the medication or the therapy, the product. But yeah, I wouldn't recommend it for everyone. I always tell patients if they come to me and they're like, so-and-so doctor recommended that I do this. I'm like, think about it.
Right.
Make sure you get a couple opinions. And then if it's like $3,000, then you need to be thinking like, am I doing the right thing for me?
Absolutely. And the results are also not like 100%
Exactly.
there. It needs more of research in this field.
Yeah, 100%.
Increase the accuracy of like the treatment, right?
Yeah, people will use this everywhere. Like I've looked into it, and people will use it for like retina surgery or hair transplant.
Oh, really?
So these products, the regenerative products, are being used for all kinds of things, obstetric surgery as well. So for my field, to me, when I look at the data, the really best data is looking at the knee. And then the shoulder, major joints have really good data. And then everything after that, it may help you. And if you, like I said, if you have a lot of money to expend, then it's fine to try.
That's what Turkey does. The hair growth.
Hair transplant. Yeah, they do lots of that.
And you just go there.
I don't know if they use PRP for all those common ones that you see on Instagram, but I'm sure that they offer it. They probably have a menu and they're like, you want to try PRP for this? Yeah.
There's a very interesting YouTuber. He goes to different countries, and then he did an episode on like the physical stature. So I think it was Korea where he went to.
Yeah.
And then in Korea, he went to this one place where they have like beams.
Okay.
And if you pass through that one beam, that it on top of that, it shows like your physical, like you are fit, you are obese, you are this. Because in Korea, they are very particular about like their health. Everyone should be like skinny frame, like straight frame, right? He was talking about like how you said like how easy it is for someone to get. So they have these clinics where you can just walk in, and GLP-1 or any of those drugs for fat loss, they can just give you the injections.
Yeah.
And you just take it and just walk out without, and it's very bare minimum consultation. Basically, they're marketing it to you. They ask you some basic questions, and then they don't care about your history.
Yeah.
They'll just give it to you. You go and take it.
Right.
And he was saying that, and he's a fitness influencer. So he's himself like too much into fitness, learning about it, everything and all that.
Yeah.
And that got me thinking that you were talking about like the Asian side of the way of treating a pain or anything. It becomes a norm.
Yeah.
That somebody, you see something, and this is a perfect segue because I'm going to talk about gymming now. Gym and pain fit the gym that comes. So first of all, when people say no pain, no gain.
Right.
And it's good. Like you feel good after lifting a heavy set. You definitely feel, but there's a lot of ego lifting. And when you ego lift, you go through an injury.
Oh yeah.
When do you know that you have like something that's wrong?
Oh yeah. If you're out there deadlifting and you suddenly feel a pop, and then you have radiating pain down your leg, like electric sensation or something just going from your back down your leg, that's an instant like you've done something. And that can be pretty acute too, like acute meaning that it may just heal on its own. But if it's pervasive, if it's continuing, that's a problem that you probably need to get looked at. And I always tell patients with any of these spine-based injuries, of course, like if you start having incontinence episodes where you're urinating on yourself or defecating on yourself, or you can't feel your groin, or all of a sudden you're having neurological changes where you're falling, or your leg, you have to drag it, or something like that, you need to get seen sooner than later. And most of the time, if those things are happening, that's an emergency. But if it's like constant pain going down your legs, like that sciatica type pain, you probably did herniated disc and injure and cause a nerve to get pinched, and you should probably get that checked out if it's continuing and not improving.
I want to also ask about this. Like I said, like society set a norm, like you have to be certain this way, so you're going to go this way. And then if something is wrong with you, you will try to hide it because you will feel like, I shouldn't.
I'm weak or
something.
Yeah.
Yeah. So in terms of like pain as well, same thing goes. You go and talk to within your family itself. There are a lot of like, let's say we are Indians. They see, back in our country, home, or in India, they do say that, that's all desi remedies, use this haldi thing, wrap it up, heat it up, and some very old methods and techniques that have been passed on in Ayurveda and all those ways to deal with pain. Do you think that, obviously, there has to be some science behind that as well, because that's been there on earth, that product, and it's been just not modified to bring out any certain things from it. How do you look at that? Like an Indian way of like dealing with pain?
I think that a lot of maybe US trained physicians have mixed opinions, right? I'm of the mindset that those things probably can help you. they're just, alternative medicine is a whole field in and of itself, and it also can be beneficial.
So Ayurveda is alternative?
It would fall within, in my mind at least, it would fall within alternative medicine instead of your traditional Western medicine, rather. Prescription medications and surgery and stuff like that.
Right.
So I do think that stuff has a time, and one of the very interesting things is probably the evolution of turmeric in American society in the last 10 years.
How is it?
Oh yeah. I see patients all the time that you wouldn't even expect that probably are not that fond of other cultures. And they're like, yeah, I take turmeric. And in my mind, I'm like, wow, my mom used to make me drink that as a kid when I felt bad and stuff like that. Right? We've been doing that stuff for centuries, and now it's become this very popular thing. And people will be like, well, do you think I should take some turmeric? Do you think that's okay for my inflammation? I'm like, yeah, you should do that. As long as you don't have any side effects from it, probably not going to harm you, and it can probably help you.
Right.
So I'm of that mindset. If you can, explore those things, do it. Especially if it's healthier, natural things. I don't see a reason not to.
So that's definitely, you're saying it's a good thing, certain things that you should take.
When my patients come in and have that already kind of mindset that they're trying to explore these more natural remedies, it gives me a good sense that this person actually does want to, explore getting better, whatever that means. They're they're not looking for just pain pills.
Correct.
They want to do what it takes to get better. And so that's always a positive in my mind.
That's awesome. So so that's another thing you pointed out today was that you need the willingness comes first. So when somebody kind of tries and says, okay, I don't want to take a medication, that's a good sign.
Yeah.
Then that person, you would want to work with that person to get them.
Oh yeah. I mean, I'm going to work with anyone to help them.
No, but I mean, I'm saying you get happy as a doctor.
Yeah.
Okay, you also want good patients.
When I meet them for the first time. Exactly.
You want good patients who are, who kind of want to work with you.
Exactly.
Instead of just trying to always.
They're actually coming for a consultation to actually learn how to get better, not just expecting me to just, miraculously cure 80 years of back pain.
Exactly.
I can't do that in one visit.
No. And I get it, but that's a good perspective to have and know that the Indian the ways of us treating something can also be a good alternative. And it's an alternative kind of medicine.
Yeah.
Okay, perfect. So now sports. Again, I love sports, and injuries are the biggest thing right in there, right? So this happened. I'm not going to name the player, but there's been constant question that once you get an injury or surgery or anything, right? Every athlete they might go through certain things.
Sure.
They went to rehab, and then they were cleared within a span of, let's say, maybe 6 months, depending upon the injury. They play one game and they're again out. Let's say once you're cleared, you are good. You should not be getting that same impact on that same place again. And if you're going to have that, why would you be cleared? So what is that pain understanding is what we miss. Yeah. And something like this happens. And this happens at an international level. So that means it's not a good sign.
I mean, that's a whole field of itself, right? Sports medicine is its own specialty. And of course, there's orthopedic sports medicine and non-surgical sports medicine, all those fields. So I don't have too much experience with handling athletes like that, but my theory, my understanding is that, maybe that area didn't fully heal, that the patient or the athlete is functional, and maybe they can throw that pitch at 90 miles an hour even after their injury, after 2 months of physical therapy. But, once an area has been damaged, that damage isn't going to fully change itself. There's still going to be small, minor things at the maybe even microscopic level that we're not able to see with an X-ray or an MRI that is going on. And so you keep doing the same motions, eventually wear and tear is going to catch up, even if it's healed over once before.
But so your pain management doesn't, not just your pain management, but like in pain management in general, doesn't apply to sports as well?
Oh, it does. But
just in a different form?
Generally, if you're like an athlete, you'll go to a specific person that does sports medicine. Yeah. So you won't go to an interventionalist or a chronic pain management specialist like myself. Most of the time, if you're still actively participating in a sport and you're really trying to heal yourself specifically to get back in that sport, you're going to go to someone who specializes in just sports injuries.
Awesome.
Yeah.
And now, so in the next segment, let's spend some time on like the real world scenario. Okay. A kid growing up,
Sure.
I'm going to take example of my kid. I want him to play soccer, right? And he wants to, I want him to have some kind of a longevity.
Yeah.
I'm just giving you an example, starting from the young age. What kind of precautions or maybe 3 or 4 tips that you can share that as a parent who are trying to get their kids into something which is more impact sport,
Yeah.
can try to work with the kid, or not just need the specialist either, just you can just simply do this at home.
Yeah. I mean, big things, of course, safety, form, and just listening to your body, which is hard for a kid to understand. But I think that kids have mostly a good sense of like, am I pushing the limits too much? Like, can my body bend in this direction, or should I be, running this fast without down this slope, or whatever it is? There's some intuition in that, but safety is the biggest thing. So if you're playing, football, make sure that you're wearing all your protective gear. Sports injuries, they can be devastating, especially at younger ages. It could change a person's life.
Right.
So doing those things, making sure you wear the shin guards and all that, those are important things. And then stretching, all the normal stuff, staying hydrated,
Right.
making sure that you're eating the right foods before and after your exercises, all of that stuff. Same as adults.
Yeah, no, I mean, and again, because you want to like have some kind of a blueprint that it can benefit the folks who don't have access to like the best of the medication or medicine field, but they still want to like have some longevity in their sport.
Yeah, I mean, it's a beautiful thing, the internet. As you're on YouTube, you probably have seen, you can find anything on there.
Yeah.
Same thing with all these different forums, Reddit and all that. So,
but it also could be misleading.
100%. That's probably one of the biggest things. My biggest fear for medicine into the next century is that there is a lot of misinformation out there, and it can be very confusing for a patient. So finding trusted sources like big hospital organizations that specialize in these things. So like sports, I would trust like a hospital system like HHS up in New York, who specialize in orthopedics.
Right.
They have probably all the videos you could think of for stretching and prevention of injury, as well as treating injuries afterwards and how to heal them.
Right.
So trusting those kind of bigger names is probably a good place to start for these general things, for sure.
Right. That's why I do this with this podcast. Like more from lifestyle, I bring in people who are professionals.
Yeah.
And basically, like when you try to contradict something that's on the internet, now they have some trustability that, okay, no, here you listened it, and it's coming from a very, very qualified source.
Yeah.
And we have had such episodes in the past that, have broken so many myths with like I said, chiropractor. We had chiropractors, we had like fitness trainers. We're actually having one of our next guests is going to be like, they're into fitness trainers.
Yeah.
And they have been in that space for an extended period of time.
That's good.
And I'm excited to talk about like CrossFit and different types of trainings and stuff with them.
Should ask about the regenerative medicine.
100%. I'm going to bring that up.
At prevention of injury. They'll be big
I'm going to. That was that. Now I'm 100% going to bring that up with them. So just get their opinion about what they feel. End of the day, it's all opinion, right? And let's okay. One more question. So people will invest like lakhs and crores and thousands of dollars on some cars or something, but they will not spend time on their mattresses. Like they will be having it for 10, 15, 20 years. Pillows. And they will just not realize it or spend it. Or we even rotate our mattresses after every few months, like
flip it
around, just so, we can have a striking balance. Can you talk to me about that a little bit? Like what role does mattress play in anyone's life?
Yeah,
be it a young kid or a...
Yeah, I've looked that up myself about pillows, because many patients have asked, like, what's the pillow that I should get? Or what's the mattress that I should get? And honestly, this opinion, just like we talked about, my opinion is that it probably doesn't matter. It's all whatever keeps you most comfortable and is within your price range. A lot of it falls down to marketing. So I don't think that there is any one pillow that's really going to cure your neck pain or really going to change your back pain.
Mattress.
Yeah, it's all preference. I really truly believe that. So whenever patients come to me, I'm like, I've read the studies. There's nothing that points one way or another. I can't tell you that this is the one to get and these are trash. So I'm just like, all right, get something that's reputable, get something that you like, get something that you can afford.
So the whole thing about the spring versus the foam, it's not really
I don't know. I use a foam mattress. I stopped using spring mattresses because when they pitched it to me at the store, they were like, oh, all these pressure points and it'll be more balanced. And I'm like, oh, that sounds pretty good. All right.
Right.
But I don't know if it makes that much of a difference. I'm I trained in anesthesiology at a very busy hospital system. So anytime I had to take rest, I could fall asleep anywhere. So I'll fall asleep sitting in a chair.
Right.
Because if I know I have 5 minutes and that's all I have, I'm going to take that nap quick.
Right.
So to me, I'm like, whatever. As long as I get a bed, a sheet and a pillow, I'll take that. I'll get a good sleep.
So that's awesome. Because
not everyone's like that, obviously.
Yeah, but so that's a good thing to know that mattress doesn't really play that much of a role. But because like some days, there are some days, not every day, but there are like some days when I have to literally roll over and I'm like, Shivani, push me off the bed because like sometimes your back hurts, it gets cramped. Yeah. When I've had really lot of exertion, like in the like couple of days before, I have sometimes there's this back, not pain, but like soreness. I'm like, you got to push me out of the bed or I'm going to be here for like hours.
You can't get out.
And I'm loving it, but I have to get that work done. So
I think that more so probably than the mattress itself, it's probably your positioning that I would focus on. So I do think that those mattresses that have the incline features, I think those things can probably help you a little bit more than just the mattress itself. Okay. Because it can form a little bit to the normal curvatures of your back.
Gotcha.
It's not for everyone. If you have, a big fusion, your back has been fused with surgery, you probably don't want too much curve and pressure in different points. So it's very, you got to tailor that obviously. But if you have a normal spine and no other like major issues, then having a little bit of curvature that matches your back is probably a little bit better than just laying completely flat.
Right. You know what has really been a revelation for me is that it's just the walking and that light jogging that I do. I feel like I'd done this like last year or something where I did it for a month consistently.
Yeah.
Where I was just walking and being more active. I could see such a significant change in the way I was getting up from the bed, the way I was moving around, like I was feeling so much better.
Yeah.
Versus just, being lazy, because that's the best and the easiest thing to do in the world.
Yeah.
But it comes with a price that you mess up your posture or things. But that really helped me.
Yeah, I always tell patients a body in motion stays in motion.
Yeah, walk around. And so while we're on a sleeping position thing, pillow between the knees when you sleep on the right side. I sleep on my right sometimes. I like to float around. I cannot sleep steady. Yeah. I'm not that steady sleeper. What do you feel? What do you think? Can you give us some guidelines around that? Is it good, bad?
Yeah, usually when I see that someone's putting pillow between their legs when they're a side sleeper, I'm thinking that they have some arthritis that's developed in their knee. That's usually the signal to me that's what
I don't do it because of that. I just started like playing with it and I just like started liking it. So I just do it.
Sometimes it's a comfort thing. Sometimes it's a comfort
thing. Like for example, here I don't have that, so it's fine. But like when I'm home, I like to sleep like that.
Yeah.
But is it any advantages or should you do that? Should you not do that?
I think that is probably good. Putting a little bit of cushion between your knees. When people are asleep for surgery, back when I did anesthesia, you have to pad everything because the patient can't move. Naturally, when you're sleeping without going through a surgery, when you're just sleeping at night, your body is constantly moving and you don't even realize it because it's correcting its position. This nerve is pinched. It's going to move it a little bit to correct that.
Right.
And so having padding is one of the ways that you do that in the operating room to protect someone who's asleep under anesthesia,
right?
To prevent those longer term injuries. So it's the same concept. We'll put pillows between the knees. We'll put pillows under someone's breast if they're on their stomach.
Right.
We'll pad their elbows, things like that.
Then what about the pillows? Like you did bring it up, but we never talked about it. Like I prefer like skinny pillows.
Yeah.
I know my wife doesn't care about pillows. She'll just sleep on any pillow.
There you go.
Is that okay?
Yeah.
For you to have like ask for a skinny pillow or just no pillow?
Yeah, I mean, I don't like skinny pillows. I like mine a little bit more
fluffy.
Not even fluffy. I like them just larger and a little firmer. Okay. Yeah, which some people don't like.
Wouldn't that mess up with your posture or anything like that?
I sleep a little bit higher on the pillow, so more of my back is under the pillow.
Okay,
so yeah, everyone's different. Again, that's what actually got me looking into the sleep part. Is I started looking into all the literature about it, and I was like, all right, everything is mixed. There's a paper here that says the pillows matter, and there's a paper here that says the pillows don't matter. And overall, I think it's a wash. I think that it's just again up to you.
So in your opinion, all of that is secondary.
Yeah,
you're focusing on the wrong thing instead of focusing on yourself.
Yeah.
And one technique that I personally have just shared was just being active.
Yeah.
That has made some drastic
as much
changes.
As you can be.
And I'm surprised that it has made those sleep better. I sleep good. Yeah. And that's changed a lot. just by doing that spinal tweaking.
Yeah, I feel bad for the patients that go and spend $500 on a pillow, and I always want to see them in 2 or 3 months, and then I'm curious to know from them and ask them like, hey, has your neck pain gotten better? I don't, because I don't want to like, upset them, but
Yeah.
I have a feeling that most of the time it doesn't change anything.
And maybe also like it's also for you, it's a kind of a research, right? Let's say if it worked for somebody,
I tell them that.
Might recommend.
I'm like, hey, if you're going to buy it and you loved it, tell me, because I want to tell other people about it.
Right.
Yeah. There's always things out there. I'm open. So I tell all my patients, like, if you want to explore that thing you saw on the internet, I don't think you should. But if you do it and you find that it helped you, tell me.
Yeah.
Maybe I'll look into it a little bit more.
That's
open.
awesome.
Yeah.
We had a dentist in one of the seasons, and such a fun thing.
Yeah.
She almost kind of on your lines of explaining, and I was asking the same questions. Colgate, close up, so much. Like, you tell me what should I use, and she kind of said it's all marketing.
Yeah.
It's like just no, keep it simple. And we talked about like same thing. What we talked about today was our Ayurvedic or like the non-allopathic route.
Yeah.
And then she said, it's all these things kind of work. And but it's just that they are like kind of supplements.
Right.
You have to still get an expert opinion once.
Yeah.
And then see how supplement can and what's the window? Do you want to test it for a month, 2 months? The doctors will tell you. Sometimes people will just keep on using it for like years, and they will just get so used to it that if you stop that, then they will have a problem with it.
Yeah.
So they feel that they have fixed it, but they haven't.
Yeah. I tell patients sometimes if you're convinced that something is helping or it's not helping, the only true way to tell is to stop it for a little bit.
Correct.
And see.
Right.
If your pain spikes up and you're like, I'm in agony, it probably was helping you, and then maybe you should get back on it.
Perfect. Okay, now one more question. It's like more of surgery based. So let's say a young person comes who is in his 30s or 40s, and young person, right? And they have a slip disc, or they have like herniated disc. They have something wrong with their any of the levels in the spine.
Yeah.
And then doctors sometimes tell them that okay, go for surgery, don't go for surgery. But then it's your opinion, your personal choice as well, right? That you can decide. How do you look at that from a pain perspective? Because some people I've seen personally who it's unbearable pain for them, but the doctors still don't let them go for the surgery.
Yeah. Yeah. I always tell patients, I'm glad that you brought this up. This is probably one of the biggest things in my field, is that you get an MRI on us, we're 30s, 40s, you're going to find stuff, and it may mean nothing. Right. You have to look at what's going on, compare that to the patient, what they tell you, and then take the MRI after all of that information is collected and try to see if things match up with that. Because if you scan everyone's going to have some sort of herniation. Actually, everyone's going to have some pinched nerve or spinal stenosis, and it scares people when they hear that, because it's something that they may just hear in passing from someone who ordered an MRI that doesn't really understand what that means to the patient. They're just like, oh, it says spinal stenosis on the radiologist read. But, spinal stenosis is going to happen to almost everyone by the time that they're 80 to some degree. It's just a matter of is it actually causing a problem? And so when people see that, they automatically get scared and they start seeking opinions. And that's when you get into trouble. You start seeking surgical opinions, and then if you push enough, you may end up having surgery that you may not have needed. And so I always, I love working with my surgery colleagues. I really respect them, and I respect the ones especially that, they view their patient interactions as the patient has to convince me that they need the surgery. I'm not here to convince them that they need surgery. They need to convince me. And so I really respect if a surgeon is like, I'm not going to operate for X, Y, and Z reasons. Of course, they give their reasons. So if a surgeon tells you that they don't think that you should get a surgery, I would take that as a blessing personally, even though you're in excruciating pain, because surgery is not guaranteed. Nothing is guaranteed. Yeah. Even my field, of course, is my injections. They may not help. Right. Medications, they're Band-Aids. They may not help forever. They may help you feel good for a little bit, for a few hours.
Right.
It's not going to take care of everything. So even if you get that big surgery that you think is going to solve everything, it may help for a little bit, and then it might come back after a few years, or it may not help at all and may make things worse. So everything, it all has to be taken into consideration together. Right. And I can't tell you how you feel pain or how I feel pain. Everyone is going to experience pain differently. It's all subjective.
Got it.
And that's the important part. So listen to the patient, understand what's going on, look at their MRI, and try to figure out, like, is this truly a surgical need? And I always, again, like I said, I'm pretty open. I open anytime I have a patient that comes to me for a consultation, especially on their first visit, and I review their MRI with them. I show them the pictures. I think that's very important, that people need to see what's going on, especially if they're visual learners. But then I ask them, I'm like, hey, you have this issue. It lines up with your pain. Do you want to see a surgeon? I'm not going to stop you from getting that opinion. I don't think that you need surgery, or I think that you need surgery. Do you want me to send you out? So I just give that option to them. Just like you said, I give them that option, and they see the surgeon. They may get offered surgery, and then it's still their option. Right. And so I can't tell you if it's right or wrong. And surgery is hard. You can't choose. You can't test drive a surgery like you can test drive a car. You just got to go for it and then see what happens. So that's the hard part, and it's a hard decision.
How much of that is actual surgeon saying that I have this process, or this, I've learned this in my college, in my medical school, and how much of that is really like very, very dependent upon every single individual, like recommending for surgery versus not recommending for surgery? Yeah.
I mean, all of that comes with that intense surgical training that they went through, and all the patient cases that they've seen, and, all the extra learning that they did, their experiences, a lot of it comes to that. So, if I always tell patients too, if you get one opinion and you think that it's not right, go get another opinion. If two surgeons are giving you the same exact opinion, they're probably onto something. And then some people are still not satisfied. They want a third, and they want a fourth. And sometimes all those opinions, if they keep lining up, I think that you need to reevaluate what you're looking for out of these consultations, what you're looking for long term.
Okay. Yeah. One thing I'm learning while you're explaining this is that there is really no short solution for a pain.
Yeah, nothing guaranteed. I can't look at anything, and I don't think anyone should. Like a surgeon, primary care, physical therapist, I'll hear patients all the time like, oh, I went and did this program and they told me after 12 weeks I will be cured. Right. Or I'll get this surgery and I'll be cured, or I'll get this injection and I'm going to be cured. I never ever promised that. I'm like, hey, my job is to try and turn down the volume of your pain as much as I can. Right. Give you the most amount of relief for as long as possible by doing the least invasive things. That's my mentality. Whether that's me doing my procedures, me sending you to a surgeon, them doing surgery, all of that's the same.
Right. Invasive is what you guys, professionals kind of try to avoid as much as possible, right? Yeah. Because then after that, there's path to recovery, and then you don't know what's after that. Even though you know that, okay, this might help you, but like you said, anything can happen when you are operating or something. So it's best to try and use other alternatives if you can.
Yeah, of course. And once you've exhausted everything, if this is still going on, then that's only a decision that you can make. It's your body. You're the only person that can decide if this is something that you think you want to do.
And how much of the age plays the factor in this?
It's huge. It's such a hard thing to think about when age is involved, because if I'm able to, prolong a patient from getting surgery by just doing simple, like an epidural, and giving them good relief for a year at a time, and they're in their 60s, and I get them all the way to their 80s, then it's hard, because now they're in their 80s and they have all these different risk factors for having surgery. Like, they may not be a good candidate for anesthesia or a big spine surgery. And so sometimes I'm like, would it have been better if they had that spine surgery in their 60s? Would things have been better? But these are the things that you can never predict. And that's why I'm always like upfront. I'm like, hey, if you even remotely think you want surgery, you should go talk to a surgeon now.
Right. That's the best course of action that you feel you can recommend.
Yeah. I'm like, we don't want to look back in 20 years from now. In my mind, it might be a good thing, because I'm like, all right, I saved this person from needing some big surgery that could have been good. But at the same time, on the flip side, I'm like, could that surgery have prevented all of this and fixed the problem? So that's why I'm like, I can't tell you what's right or wrong. I can only give you my opinion based on what I know, and then let you I tell patients, I'm here to educate you, give you the information so you can make the right decision for yourself.
Gotcha. Let's say in 2050, we are in year 2050, looking back to this present time. Yeah. Because now you see like phones, the culture of like sitting for hours for 8 to 10 hours working, dehydration because not realizing enough water. Yeah. And then sometimes relying heavily on like YouTube universities or WhatsApp universities. Yeah. Sometimes not reading the signals of your body correctly, and then still pushing because you think that no pain, no gain. Yeah. And what do you think that person in 2050 or you in 2050 looking back would be saying, I wish I could have focused on this and I could have prevented all of this, or maybe there could have been my preventive measure.
Yeah, it's hard. It's hard. We're all human, and we're all like on this grind all the time, especially in this part of the world. Everyone, wakes up and tries to hit the pavement and work hard for their whole career, and they put their health and their wellness on the back burner. And that's changed over the last few decades. I think people are really, tuning into how their body works and how their sleep is and all these things. So I think that in 2050, if you can make small changes, that's how I look at it, is that you're not going to fix everything at once, and you're not going to fix everything, forever. So if you can do small things to really improve your life, whether that's your mental health or your physical health or your diet, those things, you should do them. Right. And consistency, like we've talked about before, is the crux of it. So do these small things for as much as you can, and keep that going through your life. And, things are going to happen. Not everyone's going to die healthy, right? It's a miracle if you make it to like 80 without any issues. So if you can, do whatever you can, but it's not going to be perfect, but you can at least say that you tried.
Awesome. One of the last few things. Yeah. Sleep, like having 8 to 9 hours of sleep versus having solid 8 to 9 hours of sleep. Like any because that I'm guessing, because as you said something about like mental, right? Like your stress level. Can you talk to me about what you tell your patients? Like how do you improve your quality of sleep, or how should you sleep? You want to go into the pain management.
If you look at all these questionnaires that help you understand how someone's pain level is and how you compare it over your visits over time, some of them will have sleep quality as a factor in that evaluation. And so it's huge. If you can't get appropriate rest, you're never really going to heal.
And what's an appropriate
And
rest
that's going to vary
like?
For everyone. I think that, as you age, you need less sleep. We know that much. So some people
why is that?
That's just kind of a natural progression as you age. So,
and what's that less sleep like?
Like some people might only need 4 to 6 hours of sleep, which to us seems crazy. Like obviously you have kids, I have a kid. Like at some point you're like, whatever, sleep. If I get it, it's good. Right. I'm lucky. But yeah, well, some people naturally just need 4 to 6 hours of sleep, and that's more than enough for their body. But whatever that amount is for you, you want to try and make sure that you do that, and do the things, sleep hygiene, turn your phone off, keep the environment nice and calm. All of those things are important because, if you're hurting, it's a cycle. You're trying to get better, but if you can't get the healing, get the sleep that you need, then you're not going to get better. You're going to hurt more. And then it's just a cycle.
Right. And that's so true. Like it does happen. Like, I the other day I was joking, and I was kind of serious too. I was like, I need one just good solid night of sleep. Yeah. Because when I sleep with my kids, they wake up, and then once your sleep breaks, it is so difficult for me to get that deeper sleep level, and then I'm just lying in the bed for like 2 hours, and sometimes if I sleep after those 2 hours, that's the deepest sleep I feel like so powerful. I was like, that's 1.5 hours versus the 4 hours before. Yeah. It's so much different. Oh, yeah. I got a very deep sleep, and now I feel like relaxed. So I was telling somebody, I was like, I need a good solid like 7 to 8 hours sleep someday, Yeah. Just rest and sometimes also the day I plan, I'm telling everyone, okay, I'm going to wake up at like 9. Don't wake me up. Right. Those are the days I never, and that happens a lot. So and I'm always up by 7. Yep. Because I finished my cycle. I finished my cycle, and then I have to like wake up and just get to world. I have to like do things. So sleep is a big thing because a lot of people, they wear like so many gadgets. Oh yeah. Honestly, for me, it makes me like nervous because I'm constantly going to think about it. So I don't like to wear stuff. Yeah. I like to just sleep free. Yeah. So I don't
like alarm fatigue.
Alarm fatigue. Most of the times I wake up right or before the alarm rings. Yeah. Right or before. But there are days when alarm rings and I'm still want to sleep more.
Well, more so with these devices that it could, alarm you. You think that something's wrong, but you're like, I felt great. You had a great 7-8 hour slumber, and then you wake up and you look at the watch and it's like you slept horribly, and you're like, I don't get it. I don't get it.
That's the reason why my brother-in-law, one of the brother, he wears Whoop.
Yeah, exactly.
And he's been telling me to get into that. Yeah. And I kind of tell him that just maybe too much statistics and data I'll just be thinking about it the whole time that I slept good. I don't know what I did wrong. Yeah. And then I'll spend like days trying to analyze, figure out. Exactly. Try and search online. Yeah.
I love data. So I'm intrigued by all those devices, but there's probably some point where you're just overdoing it.
Yeah, but you are more from research purposes, right? Like how you explain that, this thing worked for you, tell me. Yeah. I might advise that to somebody else that they can give it a shot. If it's good, if it's for them, it's for them. If it's
Right.
not for them, it's not for them, right? So yeah, no, I had anything else from your point? I had a great time. I think it's good. I got everything that I had material I written.
No, we didn't get too far into like my day to day, which is good. I'm happy to just talk about.
Shall we talk about that?
That's up to you. It's
Maybe I would like to know what a pain management specialist day looks like, because when you're guiding people, it will maybe your day to day has something that we can all take from you.
Yeah.
How does the day start?
My day starts.
Coffee, tea, green tea, no tea?
Coffee, 1 cup of coffee, and then hit the road. I commute a decent amount for work. So I'm on the road and then get to my clinic, look at my schedule. I usually look at the night before, to be honest, to just make sure I'm not going to like walk into a giant, mess.
Right.
But see what I need to do, try and plan a little bit. Like, okay, these patients will need a little bit more care. They're coming in after surgery or whatever it is, or I did a procedure and I need to follow up with them. Or this is a patient that I've seen consistently over the last 10 months and they're pretty stable. So I at least get a good mindset, a game plan of the day. Or I have like these 8 procedures, 10 procedures in the middle of the day sprinkled through my like busier clinic, or I'm going to be just doing procedures for the morning. So my day is really varied.
Right.
Which I love. I love that, that it's not like I'm just in the clinic. I'm just in the clinic every day and that's all I do. So I get that good mixture where I get to context switch. Some people don't like that. Some people want really blocked off their life when they're at work. But I'm like, all right, I want to do this, and then I'm going to get done with this task, and then I want to go focus on something else and use a different part of my brain.
Right.
So that's the nice part. But it just varies. So sometimes I'm just in the clinic. Sometimes I'm in the clinic doing procedures on the side. So we have like procedural suites at some of our clinic locations.
Okay.
And so I'll go do a procedure and then finish the procedure and go take care of my follow-ups, and then see a new patient, and then go back and do another procedure and kind of circle through that way.
Awesome.
Other times I'm at a surgery center and doing bigger cases that take a little bit longer, take a little bit more planning. So you might do a couple of those and then have regular procedures sprinkled in through that time period, and then flip back over and go to clinic. So it really varies. That's like kind of the mixture. So I love that aspect of it.
So $1 million question for Dr. Watts.
Yeah.
10,000 steps a day. Where do you squeeze in all this?
I'm always surprised. I don't hardly sit at work, but my steps are low. My steps are always like 4,000, and it just comes down to the space of the clinic. The clinic is only so big, and I'm just taking small steps in between these 4 or 5 rooms or 8 rooms. And so
it's psychological, right?
Crazy. Yeah.
You would still think I did so much. And then we look at the watch and like 4,000, but you were always moving.
Yeah. I never stopped. I skip lunch most days. I'm just grinding through because I'm trying to get back home, and I can take care of most of my things at home that are paperwork.
Right.
So I really try to focus on my patients when I'm at work. So
gotcha.
But it just shocked me. Like I'm like, wow, I feel like I ran a marathon, and then I'm like, I barely left the clinic.
Barely moved, right?
Like, yeah. Sometimes like 2,000 steps. I'm like, how did that happen?
That's awesome. So your life tells me that just constant mobility is necessary.
Yeah.
What you do, indirectly, you take care of your body that way.
Yeah.
So no matter what circumstances are around you, you try to be creative about how you deal with your with your life.
Yeah.
In that aspect.
Yeah. I mean, there are some people that will just go and sit after every patient, and I'm like, why?
Right.
There's always something to be done. Might as well keep things moving, and that way I'm always moving as well.
Definitely.
Yeah.
So you fed me one more interesting topic that I think we should talk about.
Yeah.
People always say that sitting too much is bad, and then you are standing pretty much all day. Is there any flip side to the other way as well?
Yeah. I mean, your feet need rest. All that weight is getting transferred down through your spine, down to your feet. So I think that having the right cushioning is essential. So having those foam pads can help. But at the end of the day, like it's, again, comes down to listening to your body. If you need to sit, you should probably sit.
Right.
Take a break, sit down, get some rest. It's important.
So I also always wonder, okay, I myself, when I was in college and I used to work in a dining hall, and there are 4-hour shifts, 3-hour shifts, sometimes there are longer shifts, right? And when I look at all these people in some big grocery stores or fast food places, they don't provide or offer chairs or anything. They're standing. Like, do you think that is really backed by some kind of science that they don't give people chairs because they're standing for like hours?
I doubt it's science.
Can you imagine like what kind of, what's brewing in their pain?
Yeah, no, I mean, it's hard. I think that, I don't know the real answer. My theory is that it's probably a mixture of not wanting your employees to sit because maybe it gives the wrong image to the customers that they're just sitting.
Okay.
It may also disincentivize, your employees from getting up and doing other tasks if they're just like comfortable and sitting at the cash register. But I think that it's important to have that option, because some people do need to sit, and if they're a good employee, they're going to get up, they're going to work.
Yeah.
They're
They
not
do
gonna
have,
just sit there.
they do give breaks in there, I think, from their perspective.
Yeah.
After like 2-3 hours in a 4-hour shift.
They have
I don't
to.
know, maybe.
Yeah.
But in your expert opinion, for example, what would you recommend all these companies do that they should? Do you feel like, forget about marketing for a second, forget about like their business for a second.
Yeah, I think if a major company, they should really invest in the health of their employees. And, that may not be chairs at the desk or whatever it may be, wherever they're selling or, checking someone out or whatever it may be, standing at a line, handing out food or whatever. But have access to them to have a gym or a nice area to walk, somewhere safe that they can walk. Have access to like a physical therapist. Some companies, obviously these major companies have all that at the workplace, like the Googles and the Amazons. They have amazing gyms and all this access. And some of them even have masseuses come in like periodically through the week, and you have those like free facilities. So it would be great if every employer could offer that. Obviously at scale, you can't do that.
Right.
But that's the right thing to do, is in whatever aspect, if they can invest in their employee and their health outside of the workplace.
Right. And or just invent like a standing chair. I've seen it somewhere.
Yeah.
I'm pretty sure China or Japan might already have it. Like you can, it's like as if you're sitting, but you are standing.
Yeah. I've seen
have
those pants that flip out with the legs.
Yeah. Have something like that. So it doesn't give an illusion that you are still standing, but you are sitting.
Yeah.
Every once in a while.
Yeah.
And not get too comfortable. To take it even further, this is where sometimes my mind goes, set a timer.
Yeah.
If you're too worried that they will be overusing that sitting thing.
That's true. Yeah.
Just don't allow it to just open. Just, have like some kind of a timer.
Yeah.
But no, that's great. I had a great session with you, Doc. I learned a lot. I think a lot of my myths are debunked today.
Yeah.
Regarding my sleep, my mattress, my pillows, and one biggest takeaway that I feel like our audience is going to gain something out of it is something that you can do for cheap. That's just like be mobile and try to take care of your body.
Yeah.
When you're exerting it too much, follow that with ample rest so you can go back and
appropriate rest.
Appropriate rest. Yeah, appropriate. That's very important.
Yeah.
And then don't prolong seeing some expert if you really feel that that's still lingering around you.
Yeah.
That's really important.
Yeah.
So I had a great time.
Yes.
How did you feel? This is the second podcast. So
good. Yeah.
So seasoned. Your answers were so on point.
I'm ready. Yes.
I didn't have to go around. You were like feeding me like my next questions already.
Yeah.
And I had a great time. Thank you so much for giving all the information.
Thanks for having me. Thanks for having me.
And I hope this was a very informative session for everyone. So if you liked the video, please like, share, and subscribe. Like I always say, we are on all the major audio platforms now, which is a great thing. So now you can listen to those as well, and you can watch us on YouTube, Facebook, anywhere you can find access to. Just search by The Halak Show and we'll pop up right away. Thank you so much, everyone. This is your host signing off. I'll see you guys in the next episode. Peace.